Nurses balloting to strike for the first time in 106 years, also relevant to your department. What are you going to do about that?
Having respected the independent pay review body, I'm not anticipating that we'll be making any further changes.
OK, so it looks as though you'll have a strike on your hands.
Well, I think that's a decision for the nurses.
It's absolutely shameful. The Health Secretary thinks uncapping bonuses for millionaire bankers and slashing taxes for the rich is a terrific idea, but when it comes to the nurses who sacrificed so much to keep us safe during the pandemic, she thinks they should settle for a crappy real terms pay cut of over £1,000. And that comes on top of a decade of brutal pay cuts and freezes. Don't just take my word for it.
While the private sector has seen salaries rise by 4.3% since 2010, the public sector has seen salaries fall by the same amount. And I can show you some of the different jobs. A huge 12.2% hit for the best off doctors, but still 6.4% for those more junior. Midwives have had a 9.9% hit, nurses 7.1%.
A decade of Tory austerity has left the average frontline nurse more than £6,000 a year worse off due to wages failing to keep up with the rate of inflation. Is it any wonder new research suggests that over a third of the nursing workforce is considering leaving due to poor pay and working conditions? Some nurses are now having to use payday loans and food banks to feed their families. Hospitals are even setting up their own food banks for staff. And if all that's not bad enough, nurses now qualify tens of thousands of pounds in debt because the Conservative government scrapped the nurses' bursary. Is it any wonder there are now over 47,000 unfilled NHS nursing roles across the UK? And thousands of burned out, underpaid nursing staff have left the profession in the last 12 months. We clapped for our nurses during the pandemic. We called them heroes. Let's now stand shoulder to shoulder with them and help them win the fair pay rise we all know they deserve.